Hi, my name is David Riley. I'm one of the physicians here at Boston IVF. And I wanted to take this opportunity to perhaps help patients understand the initial testing that is performed when their attempts to build a family through our technologies needs to be assessed. It's actually quite basic, and it can be done in a way that is understandable and convenient. So you have your first visit. The reproductive endocrinologist, either me or one of my partners, has spoken to you and has filled out forms and discussed with you what should be assessed. And you're going to talk to his or her team about those tests. But let's just go over the basics of what typically is ordered. For those individuals who menstruate and therefore are presumed to ovulate, you call day one of your period, and we define day one as the first day of full flow. And when you call, you're going to come in on day 3 of the cycle, 2 days later. And the good news is we are very accommodating. It's going to be done on day 3 of your cycle, whether it's a weekend, whether it's holiday, it doesn't matter. We are open to be able to do those tests, especially for those patients who are worried that calendars are going to be interfering with their ability to be assessed. They're not. So when you call, even if it's a weekend, even if it's a holiday, and when you get a blood test and an ultrasound, which is known as the ovarian reserve test, even if it's a weekend, even if it's a holiday on day 3 of your cycle, we're open and available to do so. When you call and you schedule that testing, you will be instructed to schedule a follow-up visit with your physician. And that visit is timed to have the results back so they are efficiently and professionally reviewed with you to inform you what they mean and how they might impact any treatments we recommend or not going forward. So that's number 1. Typically, number 2, for those individuals, particularly planning to carry the child, who still have a uterus and have fallopian tubes, we do an anatomic survey. That's a test known as an HSG. We are the experts at doing HSGs. And what I mean by that is we know how to do it gently. We know how to do it respectfully so that it is not an onerous procedure. So how is that done? Well, when you call day 1 and you've scheduled the other tests I talked about, the day 3 test, this gets done anywhere between days 5 and 12 of a menstrual cycle. And here's how it works. A physician or a physician's assistant or a nurse practitioner is performing the test. They place a speculum. The speculum is placed gently. And an instrument is placed on the cervix. It has the same caliber, say, of a pap smear brush, and it's placed there. At the end of that catheter that has been placed is a syringe filled with a water-based dye that is gently flushed into the uterus and into the tubes to assess the anatomy of that uterus and those tubes, because a picture is taken after the dye is gently flushed in. It's a procedure that's only going to take about 5 to 10 minutes. And by coming to Boston IVF, you are coming at the experts. We're the ones who do this procedure all the time. And as such, not only will it be done well, but as I already said, respectfully and gently. The results of that test will again be available at the follow-up visit. And finally, typically, a semen analysis is done. So for those individuals for whom semen needs to be assessed, they will be asked to perform a specimen production of their semen that can be looked at. How is that done? Well, that individual will ejaculate, typically at home, in a sterile specimen cup that can be taken from any pharmacy. It's produced at home, and there's approximately 90 minutes for that specimen to be transported by that individual to our lab where it is assessed. So assessing the semen is very important because in the most typical type of infertility that couples are known to have, particularly heterosexual couples attempting conception, the problem is the male. And obviously that is something that we can easily test. So we've talked about 3 sets of tests. 1, ovarian reserve test done at any day of the week when day 3 comes in, meaning 2 days after the first day of that menstrual period. The anatomic survey of the uterus and tubes for those individuals planning to carry a pregnancy, and a semen analysis for those individuals who need to have their semen assessed. That data will be utilized at the follow-up visit. So your reproductive endocrinologist can give you the best advice on how to proceed, if you need to proceed or if you want to proceed. And that being said, let's talk about waiting for these tests. The more we wait to do these tests, the higher the chance is that you won't respond as well to our treatments because you are of an older age. So I think it's really important, now that you understand how these tests are employed, to do it earlier as opposed to later, so we can optimize success when you are younger. We recognize that before you meet us, you've already been trying a while, most of the time, to build your family. That in and of itself is impacting your success because you waited 6 months, 12 months, or whatever. So it's really important we don't wait further. Get the tests earlier as opposed to later to get a better sense of what we can do, because the younger you are, the better your chances of success. Okay. So now that you understand how we obtain these tests, it's important to recognize the timing. And what I mean by that is we understand that many couples and or individuals have been trying to figure out ways to build their family. They've been unsuccessful and they've been trying a while. And because they've been trying a while, they've gotten older. And that also applies to us. When you come here, and if you defer testing, you're only impacting your success if you decide to utilize our technologies to help build a family. So now that you understand how we do these tests, relatively simply, accurately, professionally, the earlier you do it, the better. Because we don't want you to wait too long, because the longer you wait, the more advanced your reproductive age and the decreased success that will result from our treatments. So we want to help everybody at an optimal time. And I want to make sure by understanding how these tests are employed, you have a better sense on how we can utilize the test results to help you build a family when you are younger, more likely to be successful, as opposed to being older, the result of waiting too long to do an assessment. So thank you very much. We look forward to helping all our patients build their families. It's the most rewarding job you can imagine, and we look forward to meeting all of you. Thank you.